Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, how in this moment public health can reflect on its successes and face new challenges. I speak with Joe Amon, the new director of the Johns Hopkins Center for Public Health and Human Rights, who has worked on some of the world's most complicated health and human rights problems. Let's listen. Joe Amon, thank you so much for joining us today. You're the new director of the Center for Public Health and Human Rights here at the Bloomberg School. Tell us a little bit about your background and what brought you here.
Well, let me first say I'm just delighted to be here. It's been a month now, and I've been really warmly welcomed by the school, and I'm excited to just jump in and get started. I've worked in public health for a long time now, and I think one of the interesting things about my career is that I've been in a lot of kind of different places. I did my master's degree in parasitology. I did a PhD in molecular parasitology and worked a little bit on malaria. But I also worked with community organizations on HIV when I worked at Family Health International, or FHI 360. I worked with Human Rights Watch for 10 years, leading their HIV programs, health programs, starting programs on environmental health and on disability rights. I worked at Helen Keller International on neglected tropical diseases, as well as at the Carter Center on guinea worm eradication as a Peace Corps volunteer. So I've gone through a lot of different types of organizations, a lot of different types of work. But really, for me, all of them have had the same focus, which is on how do you improve community health? How do you work with communities to identify what the key issues are, the key barriers, and to overcome those barriers to ensure that people have healthier lives.
So tell us a little bit about the center itself and its mission, and maybe some of your immediate priorities.
Sure. So the Center for Public Health and Human Rights is a center that I've had a relationship with for a long time. Even before coming to Hopkins, I was regularly down here in Baltimore giving lectures in some of the classes that center staff were running. And the focus of it is really to see how and explain in very specific ways how human rights violations can impair people's access to health and their health outcomes, and how rights-based interventions can overcome and improve health status. There's a relationship, human rights are basically a political determinant of health. And if we can address individuals, communities whose rights are being violated, we can then start to find strategies to improve their ability to get access to healthcare, their understanding of how to maintain their public health or their health
And so
status.
What are you thinking about? You're hitting the ground running here. What are your first priorities?
Well, there's a long history of working on HIV within the center, and I've worked on HIV quite a lot, and that is a kind of key priority to keep that going. We've made a lot of progress in the HIV response, but there's still a lot of communities that are left out. There's a lot of issues that come up, policies that come up, discrimination that comes up. For example, in Uganda, Ghana, and Kenya, there are laws criminalizing homosexuality, requiring healthcare providers to report individuals who are LGBT. And that is a straightforward human rights abuse, and it's a clear impediment to getting access to the healthcare that people need. So I think we will definitely kind of continue doing work on HIV, but I think that there's a number of other big issues too that exist in the world. Migration and people who are leaving failed states like Venezuela and transiting through Colombia, through the Darien Gap into Panama and Costa Rica and into Mexico, the health issues that they face during that journey, the health challenges that they sometimes are driving them away from places like Venezuela because they can't get access to antiretroviral drugs or other chronic disease medicines, are really critically important issues that I think we will continue to work on and hopefully expand working on. But, my background has also been on environmental health, and we see that those are still hugely important issues, whether it's in Louisiana with whole issues around refineries and air quality, whether it's overseas. Sometimes there's issues of mercury poisoning or lead exposure among child gold mining and informal mines. So there's a lot of things that I think we could take on, and still at the process of really looking at the interests of the center as a whole, of where we might be able to expand, how we can partner with other organizations to support work that they're doing, or to kind of bring in our expertise in terms of methodologies and measurement.
So you joined the center a month ago, and you've got a history of dealing with really big, complex problems all over the world. And you're faced now with a mission to deal with really big, complex problems all over the world. And it's November 6th, the day after the election, and you have a symposium, and you have to give a speech. And you scrap what you had written, and you rethink through what you want to say. And you gave a speech, which we will link to in the show notes, about how we can kind of reflect on where we are at this moment in public health. And I want to start off by first asking you, tell us about this moment. What is happening right now? Where are we?
Yeah, the panel was about discrimination and health. That's a hugely important issue, but it was clear kind of post-election that there were much bigger issues that we needed to discuss too, and we needed to think about, and that there was an immediate reaction about, what is this next administration going to bring in? What kinds of policies, what kinds of changes, and how as a field of public health professionals do we engage and respond to those changes? And for me, I think one of the key issues was just remembering that we didn't have it perfectly figured out in the last administration. We have challenges in our field that are still works in progress, that are still needing to be addressed. And one of the big ones coming out of COVID is that there's still a lot of sense of distrust between public health professionals and communities. The other aspect of this was misinformation and disinformation, right? And that emerged during COVID and continued, and people were concerned about political appointees not addressing that, but continuing that or inflaming that. But I wanted to, in my remarks, really kind of underscore that, we faced these problems before. We've seen these issues, and we have a choice to make about how we're going to engage and really address them. And I think it's critical that as a field, we really question ourselves about where we've been successful and where we've come up short. And that conversation, sometimes in the public health space, is made into a very abstract discussion of we have health disparities. But let's talk about what that means. What that means is that certain communities aren't getting the support they need, the help they need, the resources they need. And how can we as public health professionals start to bridge that gap in real ways? And to me, part of that is being better listeners to those communities and what their needs are, thinking more about how the public health field in general can look like the communities we work in, and not stay in our offices, but really engage in those communities directly. Who are the leaders of those communities? Who are the people that people trust in those communities? And are we working with them? Are we amplifying and asking them to amplify our messages so that we can break that down? And one of the concrete ways that I think this could be done, is we educate students often at a master's level in public health, sometimes at an undergraduate level. But we should have public health degrees in community colleges. And that could be enough to have a community college degree in public health to work in the field as a community health worker. Or it could be a pathway into an undergraduate degree and then a master's degree. And it should be both. And I think we need to start having some of those ideas and getting back to a sense of public health, not just as information that we're pouring into communities, but as a social movement, as an engagement, as a relationship with the communities we're working.
I really like that because, I think a lot of what we're thinking about right now as public health communicators, it often feels like a one-sided conversation, and we're just putting all this information out there and we're like, why aren't you taking this up, And we know that we face some major challenges potentially in the near future when it comes to things like vaccine skepticism and just this general distrust of public health institutions. What else could we be thinking about right now?
To me, I think that one of the things that we struggle with as a field is the idea that we're apolitical. We're scientists, we're technical, we're researchers, but politics can't be separated from public health. We have to recognize that that's the world we live in, and everything we do is shaped in some way or another by a political lens, either the people that we're working with, funding environment that we're in. And so I think it's important for us to talk about how we do advocacy. We're not just studying health disparities. We're also trying to get changes at a really fundamental level to make society fairer, to make people have an equal opportunity to good health. And so I think that's one of the issues. I think another issue is to really recognize who we could be partnering with more in communities, and whether that's engaging with schools and elementary schools to high schools to beyond, whether it's communities and different kinds of religious institutions, whether it's occupational health and sort of unions and sort of who are these different leaders that we haven't done enough to connect with and to really see as people equally invested in the health of their communities.
The work of the center has a very global focus. And how are you thinking about these politics at home and the center's work in other places?
Well, I think one of the most immediate concerns is there's a real fear that a lot of global health funding is going to be cut. The U.S. is one of the largest donors, provides almost half the funding for the Global Fund against HIV, TB, and malaria. If that fund's cut, the work that the Global Fund is supporting in countries around the world is going to suffer. The local organizations that are implementing that work are going to also be really constrained. There are emerging epidemics that can become pandemics occurring all of the time. And so we need to think also about that the global becomes local. People are moving, diseases are moving. Like, we have to be aware that we're all in this together, and there has to be a sense of solidarity.
I want to go back to something you said earlier about thinking of public health as a social movement. And I think this can be our final question here. A lot of people that listen to this podcast are students of public health. How can they think about themselves as part of this movement?
I think there's a lot of different ways to approach this. But one of the things that really struck me when we were in COVID and Black Lives Matter was happening was at those manifestations, at those marches, people were also there from the medical and public health community with signs saying healthcare is a human right. And then that kind of disappeared a little bit. And I haven't seen that as much being identified, promoted, and people out in the streets demanding that. And I think that, to me, also spoke to the way in which we need to collaborate with other movements. We need to recognize that, we can be supporting other movements and they can be supporting us, because it really is about a sort of transformational change. And we have an understanding that education is a human right. All kids have a right to go to school. But the U.S. is very separate from most of the world that have recognize that health is a human right. And I think we need to catch up, and we need to emphasize that if you don't have good health, you can't exercise all of your other human rights. You're unable to be fully engaged in society the way you should be able to.
Well, thank you so much for sharing your perspective with us. We really appreciate your time.
Wonderful. Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.